While the president calls for reopening to be accelerated in some parts of the country, his health experts are urging several states to scale things back. Our lead national correspondent David Begnaud joins us now from Miami Beach. David, how is all of this back and forth affecting businesses there?
Well, take Cafecito, a restaurant that's been run by a Cuban family for the last 40 years. Business is down 90% here, and they're not sure how they're going to stay open. A recent report by Yelp says that here in Miami-Dade County and two nearby counties, almost 3,000 businesses have closed since early March. So with jobs disappearing, and some people set to lose that $600 check they've been getting from the government for the last several months, there's a lot of tension, and you can understand why.
We're seeing a lot of just panic, and people are very scared right now.
Adrian Gonzalez says he doesn't know what his employees will do if his restaurant is forced to close. He's already reduced the staff of 17 to just 4. And on the West Coast, a similar story for Marty Caballero, who owns a Portland barbershop. He says he and many people he knows need the extra $600 that they've been getting from the federal government.
What happens when they shut us down again? There's no extra assistance. We're all getting the minimum, and no one can pay their bills at all. What happens then?
The balance of lives and livelihood is the most difficult thing of all of this.
Back here in Miami Beach, the mayor, Dan Gilbert, says his city's economy depends on businesses that draw people together, restaurants, hotels, and entertainment venues. And he says the state's contact tracing program is not equipped to handle a reopening.
83% are not being called at all. There's no contact. They're not being told to quarantine.
How does the lack of contact tracing affect you economically in Miami Beach?
Well, the contact tracing is until we have a vaccine, the contact tracing is sort of the vaccine.
The ongoing push between public health and economic concerns continue as many states see surges in cases. Listen to what Dr. Deborah Birx of the White House Coronavirus Task Force said.
We can see what is happening in the South moving north. There are states that do need to close their bars, to decrease indoor gatherings to less than 10.
One of those states is Tennessee, and Dr. Birx met with the governor, Bill Lee, but he waved off her recommendation.
I've said from the very beginning of this pandemic that there's nothing off the table. I've also said we're not going to close the economy back down, and we're not going to.
Dr. Anthony Fauci is urging states. Listen to Dr. Birx.
We've got to make sure that other states that are starting to show an uptick do what we're talking about before you get the major surge.
You know, Dr. Birx also used Arizona as an example. That state's governor didn't want to roll back the reopening, but he decided to because the cases were surging there. And within the last 4 weeks, Dr. Birx says Arizona has started to turn things around because they rolled back their reopening. And she's now using them as an example for Tennessee and other states as to why they should consider tougher measures. Gail?
Boy, David, I always think it's a good idea to listen to the scientists, the experts who seem to know what they're talking about when it comes to this topic. Thank you very much, David Begnaud, reporting from Florida.